Kevin, thanks for joining us today. So Kevin has joined us today to talk to us about one of the studies that he has just had the success of being published in Knee Surgery, Sports Traumatology and Arthroscopy, which is a European journal, prestigious European journal in orthopedics. So Kevin, thanks very much for coming in.
No worries.
Can you start off by telling us a little bit about yourself, and then we'll talk about your study?
My name's Kevin. I'm one of the final year medical students, research assistants here at Sydney Orthopaedic Research Institute. I've been working with the surgeons and the fellows here for the last 2 years. It's been a very enjoyable time so far, and I look forward to continue doing some work with everyone here.
So can you tell us what was the aim of the study?
So the primary aim of the study was to look at the outcomes for patients receiving this osteotomy procedure here at this institution, and also to look at the factors that can help predict whether someone might be converted to a total knee replacement earlier versus later on.
Kevin, can you tell us what is an osteotomy or a high tibial osteotomy, and who are the kind of patients that have this operation?
So a high tibial osteotomy is essentially a procedure designed to realign the knee joint to delay the need for a total knee replacement. By realigning the joint and the forces that's going through the knee joint, we can help offload certain compartments, so the outer and inner compartments of the knee, to delay the onset of more severe osteoarthritis.
Okay.
And patients who often receive this procedure are younger patients with osteoarthritis, and we know that younger patients tend to require, or more likely require, revision total knee replacements later on in their life if they do receive one earlier, and so this is a really good procedure to try to delay that from happening.
Great, so this is a procedure designed for young people, really, with osteoarthritis, and we're trying to slow their progression to requiring what will eventually be a total knee replacement. Is that what? Yeah,
that's correct.
Great. Okay, so Kevin, can you just walk us through actually how you did the study, so the methodology?
So the study was a retrospective cohort study. What that means is we took a number of patients from the database who have previously received this osteotomy procedure with various surgeons at this institution. And so in the database, we gathered information about the patient's age, their name, demographics, so how old they were, their age, their sex, their gender, as well as their BMI, and other bits and pieces of information about the operation that they had, and any other operations that they've had in the past.
Mm-hmm.
And so by collecting all this information, we can examine the trends of different patients. So for those who had a longer survivorship till they required a knee replacement, or for those who are still going with the osteotomy procedure. And then we can also examine the factors that cause some of these patients to require a conversion to total knee replacement earlier on as well.
And then with these patients, you were following them up for how long?
So for these patients, most of our patients, we followed them for at least 10 years. Some patients were lost to follow-up, which means we weren't able to get in contact with them. So we only have a shorter follow-up, so 5-6 years. And then for some patients, we actually managed to follow them for a really long time, up to 15 years.
Wow.
But the majority of patients that we followed up were sitting within that 10-year mark.
Okay, let's move on to the results. So what did you find?
So we looked at 431 patients who received this procedure. And the biggest finding was that up to 21 patients of this cohort actually had a survivorship of up to 19 years.
What does survivorship mean?
So survivorship is how long this osteotomy has lasted them and has continued to function for these patients. This just means that these patients have not yet received a total knee replacement, or they received one after that year duration.
Okay, so these were people who originally had an arthritic knee, they were young, and then they had an osteotomy, and they still had a functioning osteotomy, doing well up to 19 years down the track.
Correct.
So it's really quite long follow-up.
Yeah.
Okay, and what other results did you look at in the study?
So other things we looked at were the patient demographics that we were talking about before, and their effect on the survivorship for these patients.
Yeah.
We found that patients who are younger, so below the age of 50, usually had better outcomes, so longer survivorship. Patients who had less arthritis in the inner compartment of their knee joint had better outcomes as well. And those who had a more precise alignment of the knee joint after the surgery to correct the weight-bearing axis and where the forces are going through the knee had better outcomes as well.
Great. Okay, so you looked at how long these osteotomies were lasting. Did you also look at how well they were doing in terms of function?
Yeah, we did. We called up these patients and asked them questions from a scale that sort of looks at a multitude of the patient's subjective factors, such as their quality of life, their pain levels on a day-to-day basis, their function, so how well are they able to do the activities of daily living, essentially. And we found that for all these patients who that we followed up, they ultimately had a better score compared to their baseline, so before they had this procedure at all time points.
Great.
And we measured these time points at 5 years, 10 years, 15 years. And for some patients it varied a little bit based on when they would respond to us in our surveys and our phone calls.
Great, fantastic. You have the results now. What are the implications of this study, would you say?
So the implications of the study is that we are now better able to select patients for this procedure because we know what helps a patient have a better outcome and a longer survivorship with an osteotomy procedure. It also helps us, a gap, as an implication would be then identifying things that we could do better in these procedures to give patients better outcomes, such as having a more precise alignment after surgery rather than trying to overcorrect alignment and things like that.
Did you find that you got to the end of the study and there were either new questions or some questions left unanswered from this?
Yes, there were. So some unanswered questions would be, as I was mentioning before, how can we actually do these procedures in a more precise and better way to try to optimise these survivorship outcomes for the patients? So that's another research question or area that can be more looked at to determine how we can optimise these procedures for the patients, and possibly also looking at an even longer follow-up to up to 20 years for some of these younger patients, as we know some of these patients were teenagers or in their 20s or 30s when they first received this procedure. So being able to follow for a longer period of time to see if they can actually get a longer survivorship than what we've studied would be good.
Excellent. And finally, from your perspective, what was the most rewarding part of this project?
There were a few rewarding things doing this project. Getting to work with a very motivated and a good cohesive team of fellows and surgeons was one of the parts. Working with them and communicating with them how to produce a good study that will help patient outcomes was rewarding. And the second thing was getting a paper published in a good journal. So that was my first paper as a medical student, and I hope to have more coming with the Sydney Orthopaedic Research Institute. So that's been pretty rewarding as well.
Yeah, well, congratulations and thank you for being part of the team.
Thank you very much.
And here's to publishing more research together.
Yeah, thank you.
Well done.